Okay, so I had Ignacia here, and she has been having left shoulder pain for almost 2 to 3 years, which is quite a long time. She was wearing one of those, those little waist trainers to make us all skinny, and she said she got it too too tight and couldn't get it off. And when she did it, she tweaked her shoulder. And so 2 to 3 years is quite a long time to have some problems. So our assessment of her is to really just look for what areas hurt, what areas are limited, decreased range of motion. She's got good range of motion, just really specific. So on her shoulder, I assume, if we did an MRI, there might not be much findings, but I bet she has a little bit possible, maybe some firing of like the supraspinatus muscles, one of the major rotator cuff muscles. So knowing what's not firing, what's not working, that's kind of where we put our therapy on. So I'm a sports chiropractor, so I adjust all the bones, but there's a lot that we need to do with the muscles because everything works together. So with her, she'll get some hands-on work. She's now getting electric stim, which helps with the muscle spasms and the tightness. I'm going to go in all along the rotator cuff manually and just really strip out the areas. Sometimes there's areas of adhesions. See if we can loosen that up. Give her some home exercises, have her go home and do it for a couple weeks and come back, get more treatment. In her situation, since it's been 2 to 3 years, the therapy could be a long process, and at some point, if she's had it for 2 or 3 years and we do a month or two of treatment, it's not getting any better, then we look for other alternative things that, like I have an MD on staff who might, could help us out if we need it. But we always try to do any conservative treatments first, electric stim, ultrasound, hands-on chiropractic. So that's how we're going to start out with her, so we can get her back in the gym and working out. The rotator cuff is made of 4 muscles, and they're all on the back of the shoulder blade. There's 1, 2, 3, and they have a common tendon that goes out here. Do you have discomfort when I poke there?
Right there, yeah.
Compared to this side?
Oh, yeah.
Okay. So when I muscle test you, this first one up here, supraspinatus, goes out here. That guy's not holding you as well. Lats are a really big muscle. They also attach way deep inside, and they attach to the shoulder out in here, okay? So we know this guy, and rhomboids are not holding strong. For example, watch when I put you here. Does that hurt to hold up?
No.
Hold that up. I'm gonna push down, you resist. So when I do this, it's not holding strong.
Oh, yeah, no.
But watch, if I say, hey, rhomboids, and I make you stronger like this, and you test, see how it can make it turn on? So we know that this rhomboid muscle needs strengthening to help, come here, there we go, to be strong, okay? Relax, relax. I'm gonna check the lower body as well, okay? Does not hurt your back or anything?
No.
I'm checking hamstring. Don't go full force or the hamstring may cramp. I'm gonna push down, you curl heel to butt, ready, go. Nice! No pain?
No.
Okay, I'm lifting you up, hold it up. I'm gonna push down, ready, go. Awesome, relax, relax, relax. Glutes and hammies, doing good.
Yeah.
This does not hurt the hip or anything on this side?
No.
Okay. Curl heel to butt for me, please. Hamstring. Did that make this thing hurt?
No.
Okay. Hold them up and push down. Good. Relax, relax. Did that make this hurt?
No.
Okay. And the tendon out here? This is bad. That's where you hurt, right? Can you turn back over on your back for me, please? How long has this bothered you?
I think it's been around the same time.
Yeah?
Yes.
Okay. Can I poke on you?
Yeah.
You hurt here?
Right there.
That's where it hurts the
That's
most,
where it hurts
correct?
the most.
It stays here, correct?
Yeah.
Are there certain exercises you cannot do?
No, I'm able to do most of them. It's
Yeah?
just when I run, after 2-3 miles, that's when I start to feel that it's getting like numb.
And you did not have this before? It's not like a lifetime
No.
thing?
No.
Am I right on it?
Yes.
Okay. Let me check a few more. I'm checking quads, okay?
Yeah.
I'm gonna push here, you resist me and go there. Don't let me push you down. Good. If anything makes that thing hurt, let me know.
Okay.
This is fine, correct?
That's
Go there?
Yeah.
Good. That's quads. Pull heel to butt for me, please. Hamstrings, great. Straighten all the way out, please. Does your knee ever bug you?
Sometimes.
Yeah?
Yes.
I felt it click.
Yeah.
Okay, sorry about that.
That's the
Did you
reason
see
I
you just
said
kicked my
that,
fat roll? That was
the
my,
left side is for us.
this one?
Yeah.
Okay. I'm gonna turn you here, I'm gonna push you down. You go up and out. Does that make that one hurt?
No.
Okay. I'm gonna push you in and you go out. Ready, go out. Does that one make that one hurt? if I turn you here again, let's try this one again. I'm going to push this way. Pain in that area?
I just feel, yeah.
A little bit.
A little bit.
Okay. That's not sharp in the hip,
No.
correct? More. Are you able to run through it when you feel it?
Yes, I'm still.
Okay. I'm going to push out and you go in. Ready, go in. Nice. Any pain?
No.
Okay. I'm going to push you in. You go out. Ready, go out. Good. Cool, cool. Very strong. Let me do it here. I'm going to push here. You go there. Ready, go. Good. Any pain?
No.
Heel to butt for me, please. Good. Hamstrings. Awesome. There's a little muscle that's here. It's glute medius and TFL are right here, okay? And so if I come in here and you okay if I do this for a second? If I jiggle this muscle for a second, there are these little receptors in the end of every muscle called Golgi tendon apparatus. Ready? Am I on it?
Yeah.
Right here, correct?
Right there.
Sometimes if you go in here and you can jiggle this muscle and it kind of resets the reset. Ready? That's bad right there, huh?
Yeah.
So I feel that when this muscle goes in tightness, I can feel it. Ready? 5, 4, 3, 2, 1. Sometimes just doing that makes this muscle turn on. Ready? Now go. Now see how it makes it strong for a second, but I bet if you went to go do your stuff, it'd bother you there. This guy here, the supraspinatus, it's really important for like holding the arm up and then the outside. This guy's not holding it very well. Lateral delt out here is also not firing. You got rhomboids out here. Left lat's all not firing. Okay? Good enough on your shoulder?
Yeah.
No pain up here, correct?
No.
Okay, okay. Your neck bug you much?
No.
Okay. I'm going to do a little treatment on you today. Is that okay? Yes. Then I think we're going to go to another room. Is that okay? Okay. Come with me. What we're going to do is we're going to do some chiropractic and give you some exercises for PT and all that. And if it's not really responding to conservative treatments, there are injections that can totally fix it up, okay?
Okay.
Show me out here where it hurts the most.
I will say like right there.
Okay. Can I poke on you for a second?
Yeah.
Okay. This guy, correct?
Yeah.
This one, good?
That one's good.
Okay. I'm going to go here. I don't think we did this last time. This is called electric stim. What it does, it helps with pain, helps with inflammation, pain and muscle tightness for real, okay? And not that we want you to go a route for injection, but sometimes if you've had something chronic for years and years and it's not healing, I've got a medical doctor that works in my office here. There are, depending on what's going on, when I see you, I would never think surgery because you're not really limited that bad. But there are, do you mind if I'm going to sneak in here, okay?
Yeah.
Because this guy's where you ate,
Yeah,
correct?
yeah.
Okay. Can I go in from the top? That a good spot there?
That's a good spot.
Are you on a desk all day, every day?
Sort of. Probably 40% is in a desk and then
The other.
40% walking.
Yeah?
Yeah.
Okay, cool. I got here and here. Is that good?
That is, yeah.
Does it go up here much?
No.
Really stays here, correct?
Right.
Okay, cool. I'm holding your wires. Please turn and lie on your back. Aim your head to go on that pillow. Perfect. You're going to lay on this bed. It's a roly-poly, massagey bed. It's awesome. And knees down. Awesome. Underneath you is a massage bed. It's going to do that. Feel good?
Feels good.
Okay. So I'm going to turn this on, okay? It's going to help with the spasms. It helps with the pain because it kind of like tells your brain, stop sending pain fibers, pain signals. I'm turning on the outside of the left shoulder, okay?
Okay.
I'm going to go slow. Tell me when you first feel like a little buzzing, okay? Going slow, going slow, going slow.
There you go.
Feel something?
I feel something.
Okay. Now take as much as you can that's comfortable, okay?
Okay.
Tell me when to stop. More is better, but no discomfort. It may flutter, which is fine. Okay. Tell me when.
Right there.
Good? Cool. This one's on the out.
Yeah. and
Was that the outside?
That was out.
Okay, cool. This is next to the shoulder blade.
Okay.
Okay. Tell me when you feel the shoulder blade one.
Okay.
Tell me when to stop.
There.
Okay.
Yeah.
Do you need a blanket?
No, it's just good.
So, there's an injection that, if you need it, is actually pretty good, because sometimes you may have like a minor tear in one of the rotator cuff muscles, maybe primarily the one that's caused you out here. The shoulder blade is almost different than the shoulder, okay? Because they're two separate areas, but they're combined. So there's something called PRP. It's called platelet-rich plasma, where they take your blood, they spin it around, and then it separates the plasma, which has all the platelets, blah, blah, blah. They inject it right back in the injured area and kind of helps your body heal. So it's like, it kind of helps you heal without having to do a cortisone or something. So if I give you the exercise and you're doing pretty good for a couple weeks, you're not seeing any improvement, that could be the next step to like get you back where you're at.
Okay.
Got any questions about your shoulder?
No, I mean, I think with the injection, like you said, if I still don't see any improvement.
Right, because sometimes with like a couple years of problems, it could take a long time. And then if you just keep going, you're still plateaued, that means we've kind of done everything we could. So we don't want to go there, but I've had both my knees done and my shoulders, and it helped a ton. I had the same pain here, sometimes really sharp things like this movement, like a sports bra, or like putting on deodorant or something. And then he injected me, went right away, it's never come back.
Oh, okay.
Yeah.
Yeah.
And he freezes it with a freeze spray so you don't get cold, but
Oh, okay.
so it doesn't hurt. I waited like 6 months. I'm like, no. And he did it. I'm like, that was easy. So,
Okay.
are you training right now at home or anything?
Oh yeah, I'm doing it at home.
What are you doing?
Well, GI is doing the virtual classes.
Oh yeah.
Yeah. So we're doing it virtual.
That's pretty cool.
It is.
Is it easy?
It's easy. It's different, but it's.
You just watch. You have a little thing up and you watch it all. Oh, that's
It's
pretty cool.
through Instagram that we're doing it.
Uh-huh.
Yeah.
That's great. How often do you do it?
At least 3 to 4 times out of the week.
Oh, that's really good. Is it free or is it part of membership?
It's a membership. Yeah.
It's amazing you could do it.
Yeah.
One of the things that I'm lucky to know every muscle in the body, and I know where they attach, where they insert, where they origin. So I know, for example, rhomboids go this way. So you go with the direction of the muscles to stretch them out. There's other times when you would go across them, but that's why sometimes my tissue work can be pretty effective if you know exactly what you're doing, where you're going. Then what we do, after we do a little work like this, and then I adjust her, then we see if the muscles are turned back on, okay? In an ideal world, 3, 4, 5 sessions like this could really help her out in the ideal world. But every patient is different. She's athletic and strong, so her response rate won't be good. On this little muscle, the thing that she's got on her is this thing. That is the TFL, tensor fascia lata. Not latte, even though I want one. It's connected to the IT band, this long white thing. So sometimes people will have pain along here, and that's like my IT band, but often it's this little muscle here that gets super, super tight. But this is the IT band that people talk about as well. That if it gets tight, pulls on your knee, people foam roll that a lot. But for the hip, am I on it? Right there? Right there. Tolerable?
Yeah.
There too?
There.
More here?
No,
more here.
Yeah.
Okay, ready? Breathe in. And this is going to be good. And 5, 4, 3, 2, 1. This little muscle is one of the weirdest muscles in the body because when it gets interlocked like that, sorry, Ignacia. Ready? 5, 4, 3, 2, 1. It won't release on its own. So sometimes this muscle responds really well to just really trigger point work specifically on that. And it hurts a lot when I'm doing this, but it might, be appropriate. Feel good?
Yeah.
Feel kind of good?
Yeah.
So when you walk, that happens, correct?
Yeah.
Does it happen if you run?
Yes.
Does not happen if you sit, correct?
No, if I'm sitting down.
And if we did an MRI, it might show a little stuff in there, but I wouldn't think it would show anything too serious, okay? Tolerable?
Yeah, that's good.
Okay, go back here a little bit. And that's probably pretty good, okay?
Yeah.
Sweet, okay. So I know you got this, but I'll just adjust everything and help you feel good, okay? I always do it on the exhale, okay?
Okay.
Relax the shoulders a little bit more, sweet, thanks. I'm going to go mid-back first, okay?
Okay.
I do it on the exhale. Ignacia, breathe in, please. And out. Good, I got you. Little bit.
Okay.
Breathe in. And out. Good, stretch you. 5, 4, 3, 2, 1. Breathe in again. And out. Nice. Good job. Good. Okay. So in a synopsis from you, we know that you got a little rotator cuff, tendinosis causing this pain out here. This muscle's kind of compensating, hurting here, and a hip problem here. So electric stim helped with the spasms and tightness. Went in there and shredded out a little bit on the muscle tightness, adhesions. This will do a little bit more next time and adjust you. We'll take it from there, okay?
Okay.